Hello everyone. Today in Docplexus KOL series, we have with us Dr. Shabeer A M. He has 13 years of experience in diabetology and is a keynote speaker for Sanofi, AstraZeneca and Lilly. How are you feeling today, Doctor?
Yeah, good. Thank you.
Thank you so much for this interview. Let me begin by asking you some of the questions that our viewers would love to hear from you. In your expert opinion, what steps can be taken to minimize the rising prevalence of diabetes?
Yeah, it's very important these days. You see, the number of diabetic cases is going high all over the world. If you mention about UAE, actually there was a slight depression of the number of cases because of the initiative taken by these leaders of this great country. And the number of cases who are obese has been detected, and what you can do to prevent obesity in the childhood, which is the growing what you call the mark for the next generation of diabetic patients. So such preventive measures should be taken in a big scale to reduce the number of cases of diabetes all over the world. And the higher prevalence seen in India, which is supposed to be the sugar bowl of the world, which is going to be having the highest number right now, is China. India will be taking over China in a few years for the number of cases in diabetes. So to prevent that, we have to reduce the number of childhood obesity, which is growing again in India, and the fast food culture which is coming out in India.
And according to you, what would you say are some of the complications associated with diabetes?
See, diabetes never kills anybody, but it is a complication which is going to have an issue on the patient. And only one type 1 diabetes which goes into ketoacidosis is the one condition which can lead to death of the patient. Otherwise, it's usually the patient dies of other complication, organ damage. And it is interesting to note that the main cause of death is cardiovascular outcomes of the patient with diabetes, and high risk. It is like we say diabetes is like 2 times the risk for getting a death because of cardiovascular condition. So it is like somebody who has diabetic is similar to have an attack of heart attack, who had an heart attack or myocardial infarction. So you can imagine one patient who is detected diabetic, in our minds, in the doctor's mind, it is that he is a patient of heart attack. So we have to see him like that. So if people are aware of this thing, that and it is taken very lightly in India, to be frank, and there is no awareness and very little screening for diabetes. Even today I had one patient who had come from India, and she never knew she was diabetic. She had some abdominal pain, and her blood sugar came to be 364, which is really, really high. And she does not know any idea about HbA1c. She is around 70. So no screening was done for her. It's very unfortunate. On the other hand, in developed countries, even in Dubai, we have got the screening. So anywhere we go in the mall, you will see somebody sitting with a glucometer just doing the finger prick, which is very cheap and very easy. And at least we can screen these patients, and in the long term, we can find out their HbA1c, and we can get on to prevent the diabetes. Yeah, there are 2 methods of preventing diabetes. Either it is our day-to-day activities which can be improved by doing exercise, reduce the weight, physical activity, and then there is drug medication which can reduce the incidence of diabetes. One of the common and very common medication which can be used is metformin, and here people come and ask for metformin when they are seen that they are obese. How can I reduce weight? Is it metformin can be used for? But in India they are still taking this metformin as to be a medicine. Here they are taking that for prevention, more of prevention than treatment. So this much difference I have seen while practicing India and over here in Dubai.
And in your experience, what are some of the challenges associated with hyperglycemic control in diabetic patients?
The most common and the most important complication while treating any diabetic patient is hypoglycemia, where all physicians are worried about. The more you intensify, the more the chances of hypoglycemia. But that does not mean that the patient should not have a good control. But as the newer treatment which are coming up gives a better options and less hypoglycemia. We remember when we were doing our house agency or internship, we had only one medication, that was glibenclamide. And those times You see, these American people did not want this metformin, saying that it will produce ketoacidosis, and all their methods of treatment, they were saying no need of metformin because it leads to ketoacidosis, lactic acidosis. But now the trend has changed, and the first medication is metformin. If it is not tolerated, you go to the second line. So the first line is always metformin. So metformin can be even used for inducing ovulation for patients like polycystic ovarian syndrome, or reducing weight and prevention of diabetes. So this is a very good option. Anybody who is having a high HbA1c, go for metformin, bring it back to normal, then they can stop this metformin. This is not that you should continue this metformin for a long term. And once the HbA1c is coming into a good position like 5.8 or below 6, you stop it. And again, maybe 1 or 2 years he may go out without the medication. And then again you can, when it starts picking up, again put it, so that you will not have to go for the second generation medications, which are really bad. In the sense, the chance of hypoglycemia is high. Compared to metformin, with the chance of hypoglycemia is very less. But it is there, can happen, but it's very less. So it can be prevented. And we have to prevent that. That is the ultimate aim of any physician all over the world, to prevent diabetes.
And last but not the least, could you tell us some of your tips for foot care management in diabetic patients?
Foot care management means, here what we do is, all the patients who are diabetic, they should have a regular daily observation of their foot, and we say wash with clean water every day, wipe the water, keep it dry, and cut their nails and keep it clean. And you should have some moisturizing creams which are applied in the night. Here we see a lot of creams, but in our part, I don't think India they are so much aware about these creams which are emollients or dry for the dry skin. And the other problem is that if they get any injury, immediately take treatment. Here they are very conscious, and we keep on having so many health education seminars or symposium, or in the channels, TV channels and medias, that the foot care is very important, because if you have foot ulcers, it's a very bad thing to treat. So always we should focus on prevention rather than treatment. And other thing which we can do for the foot care is, for any diabetic management, the ultimate treatment should be control of the sugar. If the sugar is not under control, there is no point in taking any other care. And then the initial stages, the patient may have pain. The bad stage is when the patient does not have pain when they have got an injury in the foot. That is where we are really worried. When the patient comes and says, I got an injury, there is no pain, that means things are really bad, because he has no sensation. So then those patients are the ones who have to be more focused. And these patients take a lot of our time, the money, and their work. All these are affected. Our work, his work, and the money. So it is always better to prevent getting a diabetic foot ulcer. And it may take months or even years to get ulcer cured. And then the last stage will be to goes to an amputation. And he can go into septicemia and all of the complications of diabetic foot ulcer.
Thank you so much, Doctor, for your invaluable opinions. Once again, I'm sure our viewers are going to greatly benefit from hearing your perspectives. Thank you.
Thank you.